Picture this: the largest private healthcare company on the planet, a company covering nearly 50 million Americans, generating nearly $450 billion in annual revenue, begins the year 2026 not with confidence, but with crisis. Its stock has collapsed more than 54% from its all-time high. Its CEO has resigned, a federal criminal investigation is active, and the anger of an entire nation was simmering for years and has finally boiled over. This is not a story about a bad quarter. This is a story about a reckoning that may have only just begun. UnitedHealth Group is not just a company, it is an empire. Through its two massive arms, UnitedHealthcare and Optum, it touches virtually every corner of American medicine. UnitedHealth Group operates across more than 300 different companies, and its Optum Health subsidiary is now the largest employer of physicians in the United States, with 90,000 physicians on its payroll. For years, this behemoth appeared untouchable. It was a Dow Jones cornerstone, a Wall Street darling. Then, everything started to unravel. The descent began in December 2024 when CEO Brian Thompson was shot in Manhattan. The public reaction was unlike anything corporate America had ever witnessed. Not shock and sympathy, but rage. Millions of Americans flooded social media with stories of denied claims and what they described as a broken, profit-first system. But that was just the opening act. In January 2026, UnitedHealth reported revenue of $447 billion, but operations were weighed down. A $2.8 billion charge covered cyber attack costs, divestitures, and restructuring. The real shock was the 2026 outlook. The company guided for revenue to fall, the first time in a decade. The stock plunged nearly 20% in a single session. Today, UnitedHealth trades around $277, down 54% from its high. These are not rounding errors, these are structural wounds. At the heart of this crisis is a federal investigation with teeth. The DOJ launched both criminal and civil fraud probes. The focus is whether the company inflated patient diagnoses to trigger higher reimbursements from the federal government. In-home assessments conducted by nurses triggered an average of $2,135 in added federal payments per visit. By August 2025, the investigation expanded to Optum Rx and how UnitedHealth reimburses its own physicians. On Capitol Hill, Senate Finance Committee members launched a separate investigation into cost-cutting in nursing homes. Critics point to a documented pattern of upcoding, submitting medical codes for more expensive procedures than performed. The company has pushed back forcefully, maintaining full confidence in its practices and pointing to independent audits. In December 2025, independent reviews identified ongoing problems in Medicare, risk coding, and Optum Rx discounts. CEO Stephen Hemsley has pledged reforms, but the DOJ's criminal investigation remains open with no resolution timeline. The bull case argues the sell-off is overdone. The bear case counters that a criminal conviction would destroy the entire model. Medicare Advantage now covers more than half of all beneficiaries. UnitedHealth is the dominant player in that market. This case is forcing a conversation about vertical integration. One company owning your insurer, doctor, and pharmacy. When that much power concentrates in one structure, the consequences of its failures ripple across the entire system. The era of UnitedHealth operating in the shadows is over. The question is not whether the reckoning has arrived, it is how deep it will go. The reckoning didn't stop with a stock crash. In early 2026, the investigation into UnitedHealth moved from the trading floor to the halls of Congress. On January 12, 2026, Senator Chuck Grassley released a devastating 105-page report titled, "How UnitedHealth Group Puts the Risk in Medicare Advantage." Based on 50,000 internal documents, the report alleges that UnitedHealth transformed risk adjustment into a multi-billion-dollar profit strategy. The tactic was upcoding, using a robust workforce and AI to find untapped diagnoses that patients were never actually treated for. This effectively siphoned billions from taxpayers, turning patient charts into profit-centered assets. But the scandal ran even deeper. Senators Wyden and Warren launched a parallel probe into Optum's pay-for-non-transfer program in nursing homes. The allegation? Optum paid bonuses to keep residents out of hospitals regardless of need. At least 3 residents reportedly died. Under the weight of these probes, leadership stability vanished. In May 2025, CEO Andrew Whitty abruptly stepped down. The board turned back to the architect of the Optum era, former CEO Stephen Hemsley, to navigate the storm. But the financial carnage was already visible. In January 2026, the stock suffered its worst single-day drop in decades. To survive, UnitedHealth began right-sizing. Plans were set to divest or close roughly 550 clinics within the Optum Health division. Massive layoffs followed, along with national salary freezes, as the company fought to cut operating expenses by $1 billion. The integrated model, owning the insurer and the provider, is now being viewed as a closed loop that failed patients and taxpayers alike. UnitedHealth remains a giant, but its era of unchecked expansion is over. The question isn't just how deep the reckoning goes. Picture a titan, forced to retreat. After decades of unchecked expansion, the era of growth at any cost for UnitedHealth Group has officially come to an end. In early 2026, the company finalized a landmark settlement with the Department of Justice, marking the largest divestiture of outpatient services in history. UnitedHealth was forced to sell off 164 home health and hospice locations, erasing over $500 million in annual revenue to satisfy antitrust concerns. But the headwinds didn't stop there. New laws are delinking PBM profits, and the government has flatlined Medicare payment increases to just 0.09%. Under Stephen Hemsley, the company is executing a back-to-basics plan, exiting underperforming markets in 16 states and bracing for a loss of 3 million members. To survive the margin squeeze, UnitedHealth is betting $1.5 billion on AI, aiming to automate 40% of routine claims and authorizations. The market is watching closely. While the stock has stabilized in the 315 range, the era of double-digit growth has been replaced by disciplined consolidation. This is more than a recovery.